Focus, we have been working to uncover problems within Maryland's VA healthcare system, with issues spanning from appointment wait times to the regional benefits office. And every time we turn around, you're sending us more stories. Tonight, we hear from a family of a veteran no longer able to tell his own story.
Kelly, each time we focus on a veteran story, we're flooded with calls and emails from vets who say they are struggling to get the care they need. Tonight, the grieving family of a Vietnam War vet who died says they're struggling to get his medical bills covered. A little more than a month has passed, but it still feels like yesterday.
It's mind-blowing to me, you know, to learn that you go from one extreme to the other, almost overnight, seemingly.
In late June, Kim Brantley drove from his New Jersey home straight to Hartford Memorial Hospital to be by his brother's side.
We went from learning that he had pneumonia, from what he was told by the VA, to stage 4 cancer, to death.
His brother, 61-year-old Jeffrey Brantley, served in the Vietnam War, but the family says it was a battle right here at home that took his life.
All I know is that he was diagnosed with pneumonia, sent home with an antibiotic, and that wasn't what was going on with him. It just wasn't.
A fellow veteran who helped care for Brantley outlined a horrific series of events, being admitted to urgent care for chest pains and severe coughing, but leaving the facility because he was, quote, feeling neglected and too weak to complain. According to the first-person account, the VA diagnosed Brantley with pneumonia a day later, but his chest pains worsened. According to the account, it would be at least 2 months before he could be seen by his primary care physician.
I'm not a doctor, obviously, but the struggle just to breathe was unbelievable.
Days later, he was taken to Hartford Memorial Hospital, where tests revealed something more.
We learned that he, in fact, had stage 4 lung cancer after initially being diagnosed from the Perryville Medical Center that he had pneumonia.
Was he shocked to learn that he had stage 4 lung cancer?
Yeah, he was very shocked because he just thought that, you know, what he was told was what was happening.
Jeffrey Brantley died at that very hospital the morning after his brother's visit after suffering a stroke.
There was a misdiagnosis somewhere in this process.
The VA Maryland healthcare system cannot talk to specific cases because of privacy laws, but they requested Brantley's contact information and other veterans who have reached out to us to take a closer look at these individual cases. They released a statement to us saying, in part, while we are proud of the many services we offer to Maryland's veterans, we recognize that there are always opportunities to improve or to assist veterans in receiving their VA healthcare services. One of the most important ways we are able to improve our services is from the direct feedback we receive from our veteran patients.
I just hope that we'll get an opportunity to find out what went wrong, why it went wrong.
Days after Brantley's death, the family received this letter denying his claim because treatment at Hartford Memorial Hospital was unauthorized.
It was like a slap in the face from the government.
But in a statement, the VA says, in part, veterans seeking non-emergent care at the VA's expense must obtain authorization from the VA Maryland healthcare system prior to receiving treatment at a non-VA facility for each episode of care. It goes on to say, veterans seeking emergent care at the VA's expense do not need to receive prior authorization, but must meet certain eligibility criteria for coverage of non-VA care. Brantley says so far, the bills are adding up to around $36,000. We have put the two in contact, a step in the right direction, helping the veterans who have so honorably served our country.
We need some help. We need some help. That's all I can say is we need help.
Jeffrey Brantley would have been 62 years old today. The Brantley family isn't alone. Next Wednesday, we'll share another story, another family, another veteran's struggle. We put both of these families in contact with one another, as well as a contact within the VA Maryland healthcare system to make some changes. We hope to bring you an update on progress made in the near future. The VA Maryland healthcare system says they're eager to work with these families, but again, because of privacy laws, could not specifically talk about their cases. Their statement goes on to say that, quote, some of the feedback provided by veterans has led to internal reviews to ensure a safe environment for our patients, employees, volunteers, and visitors. They also say any veterans who have problems receiving VA healthcare services, concerns, compliments, or suggestions about the customer service provided by their staff members can contact one of their patient advocates by calling 800-463-6295, extension 7099. They also have a patient safety hotline. You can find this and more information on our website, abc2news.com/infocus. Now, our first story on the VA crisis featured 80-year-old Edward Jolson, who was told he'd have to wait 3 months to see his primary care physician. At the time, the average wait for new patients seeking primary care was 81 days. We updated you recently that the wait dropped to just under 76 days. Now, the latest audit shows new patients seeking primary care on average are waiting 76.06 days for an appointment, a slight increase from last time. We want to help our vets get connected with the care and resources they need. If you are a veteran having problems with care or claims from the VA, connect with me through Twitter or send an email. We'll continue putting pressure on the VA to get the vets the help they need.